Okay, so hormone requirements for the guys, so for female to male patients or transgender men, um, let's talk top surgery first of all. How long do you have to be on hormones before you can have top surgery? And the good news is there is no requirement. You can have top surgery without having ever been on testosterone. And, particularly for, let's say, our non binary folks, hormones aren't right for everybody. They're not necessarily part of your transition. So, for this reason, hormones are certainly not required before undergoing top surgery for FTM patients. So, I often get asked, however, should I try testosterone for a while? Is it going to shrink down things and maybe help with my result? Usually, this depends. It depends, first of all, if you have a very small chest to begin with, it could possibly make the difference between whether or not you're a candidate for keyhole versus double incision. But this is very rare. Usually, if you have any extra skin at all there, testosterone is going to do absolutely nothing to shrink this down. And indeed, testosterone oftentimes doesn't really shrink breast tissue much at all. So the answer there is it doesn't really make a big difference. And so for that reason, I don't usually have patients wait. With regards bottom surgery, again, as I always say for the female to male patients, there's a lot of different options for bottom surgery depending on what your goals are. And so if you're doing a procedure such as a metoidioplasty, where you're relying on the tissue to enlarge that's already there, that's maybe different from a phalloplasty. But 1 year of testosterone is required usually. This is a requirement from version 7 of the WPATH guidelines, which is usually where insurance get the requirements from. So for bottom surgery across the board, usually 1 year is required. If you're going to use the enlarged clitoris as part of your surgery, it's wisest to wait 2 years for the full effects of the testosterone to kick in. So just to reiterate, top surgery, no hormones required. Bottom surgery, at least 1 year, sometimes 2 years is wise. And that's it for hormones.